Welcome back to Open School. In the last session, we have discussed about the pharmacokinetics, which is easily remembered by A, that is absorption, distribution, metabolism, and elimination. Today, I will be discussing something little more and deeper into the volume of distribution. I will discuss these things on clinical based MCQs and some case scenarios. So now going to question number 1. The volume of distribution of a drug is best defined as. All of you write down the answer and then listen. The correct answer is the amount of drug in body divided by plasma drug concentration. So that is the Vd or volume of distribution. So it is an apparent volume calculated as total drug in the body divided by plasma concentration. So that is the correct answer. So what is the definition? Volume of distribution is the apparent volume that would be required to contain the total amount of drug in the body at the same concentration in plasma. So the formula, so what is it? It is the apparent volume. That is the term you should remember. It is the apparent volume. That would be required to contain the total amount of drug in the body at the same concentration as in plasma. Same concentration as in plasma. Hope the point is clear. And the formula is Vd is equal to total drug in the body, total drug in body divided by the plasma concentration. So this is the formula. Why the term apparent? Vd is not a anatomical volume. It is not anatomical volume. That is what? It is not anatomical volume. It reflects the extent of drug distribution into tissues. So Vd exceeds total body water, which is approximately 42 liters. So this is another point to remember, that is this is not the true anatomical volume, it is an apparent volume. It reflects the extent of drug distribution into tissues. So it often exceeds, or sometimes it can exceed 42 liters. So let us look into, suppose a drug has got a low plasma concentration. What is the meaning? That means the drug has got a large volume of distribution, large. So if a drug has got a large volume of distribution, the plasma concentration will be small. If it is a small Vd, volume of distribution, there will be high plasma concentration. So this is an important point to remember. So low plasma concentration means the volume of distribution is large, or when the volume of distribution is large, you get a drug will be having low plasma concentration. Last time we have mentioned the factors affecting volume of distribution. One is the lipid solubility. Second is plasma protein binding. Third is the size of the particle, the particle size or molecular size, and the tissue binding. So the volume of distribution depends upon several factors. The important ones are the lipid solubility, plasma protein binding, the molecular size of the particle, and the tissue binding. What is the clinical significance of this? The volume of distribution is large. The drug has got a long half-life. Because it is distributed throughout the body, and you require a loading dose. So which type of drug require loading dose? When the volume of distribution is high. So this is the important point that we have already mentioned. So remember this, the volume of distribution is calculated by total drug in the body divided by the plasma concentration. So high volume of distribution means extensive tissue distribution, long half-life, and need for loading. And they are poor diet. They are not dialysable. So poor dialysability. So these are the important points to remember. So higher the volume distribution means there is extensive tissue distribution. It may go to the fat and tissues, and such drugs will have naturally long half-life, and they require loading dose, and they are not dialysable. Now we go into little an example. Take warfarin. Warfarin is a drug which is distributed, the volume of distribution is less. Aspirin is another example. Volume of distribution is less. Whereas gentamicin, amoxicillin, volume of distribution is high. And we are knowing about the digoxin. Extensive tissue binding of digoxin. So the volume of distribution is very large, more than 100 liters. So high volume distribution means extensive tissue distribution, long half-life, need for loading, and poor dialysability. That is why digoxin is not dialysable. So I will discuss the volume of distribution formula in a little more simple way. So volume of distribution is the amount of drug in the body divided by the plasma concentration. This especially after IV injection is extrapolated what is the plasma concentration in the beginning. So Vd is the dose given divided by the plasma concentration. So we are giving a drug IV, that is the dose given, and plasma concentration, initial plasma concentration is extrapolated to time 0. So let us take a drug which has gone to the tissues. If all the drug in the body were evenly dissolved in plasma at the measured concentration, that volume would be needed. What volume will be needed to contain it? That is the apparent volume of distribution which we have already mentioned. That is, a drug is dissolved in plasma. If the drug is going to the whole body, what will be the volume that is required to contain it? That is why, as explained, it is called apparent volume of distribution. Most often, it may be even more than the total body water. Hope it is clear to you. And you have understood why it is called apparent, it is not anatomical. So it is not an anatomical concept, it is a distribution concept. That is why Vd can be greater than the total body water. So now take example, high plasma concentration, small volume of distribution. For example, warfarin. It has got a high protein binding. So we have explained that the protein binding also determines the volume of distribution. So it stays in plasma. So it is bound to protein. So the drug will be remaining in the plasma for a long time. So volume of distribution is less than 10 liters. So let us now take another example. Large volume distribution. So in large volume distribution is large. The plasma concentration will be low. Hope it is clear. So drugs with low plasma concentration has got a large volume of distribution. Most drugs move into tissues. Very little drug remains in plasma, so plasma concentration is low. So when the volume of distribution is large, most of the drugs goes into various parts of the tissue. Classical example is digoxin. So it is stored in heart, it is stored in muscles. The volume of distribution is high. So it is a high volume. So digoxin is an example where the low plasma concentration and a large volume of distribution. So example 1, we are given 500 milligram of a drug. Plasma concentration is 50 milligram per liter. So the drug is mainly in the blood. So volume of distribution is calculated by the formula Vd is equal to total drug divided by plasma concentration. So here it is 500 divided by 50 is 10 liters. So this means that this drug has got a volume of distribution, low volume of distribution and high plasma concentration, and the drug is mainly in the tissues. Take another example, the same dose 500 milligram given, plasma concentration is 5, so what will be the volume of distribution is equal to 500 divided by 5, so it will be 100 liters. So this explains, as mentioned, it is only it is not an anatomical volume, it is a concept, it's apparent volume. So here it means that the drug has moved into various tissues. So they have got a long half-life. long half-life, they are not dialysable, and they need a loading dose. So higher the volume of distribution, lower will be the plasma concentration. So what is the clinical usefulness of the Vd formula? So this is volume distribution. One is for calculating the loading dose. So loading dose is volume of distribution into target plasma concentration. So volume of distribution into expected or the target plasma concentration is the loading dose. As mentioned, drug with large volume of distribution requires a loading dose. Classical examples are digoxin, phenytoin. So all of us know that the phenytoin should be given as a loading dose to be effective. So second usefulness is understanding toxicity and overdose. Large volume of distribution, as explained, they are not dialysable. So digoxin is not dialysable. Small volume distribution is usually dialysis effective. Example, lithium. Lithium has got a low volume of distribution, and so it is dialysable. So as mentioned, volume of distribution is the apparent volume required to contain the total amount of drug at the same concentration at that present in plasma, and is calculated by using the formula Vd is equal to dose divided by concentration. Now we go to one or two MCQs to explain this a little more. A drug with very high plasma protein binding will have. So suppose you are injecting a drug, the drug is attached to proteins. So what will happen? Protein bound drug stays in the plasma. So it cannot enter the tissues. So the volume of distribution is low and plasma concentration is high. So drug with a high plasma protein concentration has got a low volume of distribution. This is the correct answer. Hope it is clear to you. And classical example is the warfarin, which I have. Which drug is likely to have the highest volume of distribution? The options given are heparin, gentamicin, digoxin, and aspirin. Which drug is likely to have the highest volume of distribution? We have discussed that the volume distribution depends on the lipid solubility, the protein binding, tissue binding. That is the correct answer. Digoxin is the drug with high volume of distribution because it is a highly lipid soluble. It goes to the tissues and bound there. So it has got a very high volume of distribution, usually even more than 100 liters. Hope this is clear to you. So digoxin is lipid soluble, tissue bound, very high volume of distribution. Next is A drug with volume of distribution 15 liters is mainly distributed. So normal. So what's the correct answer? Extracellular fluid. So correct answer. Less than 10 liter, it is usually plasma. Volume of distribution between 10 to 30 is extracellular fluid. And classical example is gentamicin. So less than 10 liters, mainly plasma. Now, which statement regarding Vd is true? Vd represents real body volume, wrong answer. Vd cannot exceed 40 liter, is wrong, it can exceed the total body water. High Vd drugs are easily dialysable, they are not dialysable because only from the plasma it can be removed. The Vd helps to calculate the loading dose. That is the correct answer. So what is loading dose? Loading dose is volume of distribution into target concentration. So Vd loading dose is equal to Vd into target concentration. Now we go into some case-based questions which are very important. A 65-year-old patient with heart failure is started digoxin, and as we know, digoxin is a drug with large volume of distribution, a loading dose is given. So the answer is digoxin has large volume distribution. Most of the drugs goes into tissues. Without a loading dose, therapeutic plasma levels will take much long time. So while the loading dose is given to achieve the therapeutic level early. So the key point is large volume distribution, loading dose. Another example is the phenytoin. Second case, a patient with renal failure and you are giving aminoglycosides. Patient has got sepsis. Where does gentamicin mainly get distributed? Gentamicin is polar, it is water soluble, so it cannot enter the cells. So it is mainly distributed into the, so this is a cell only, it is water soluble, it cannot enter the cells. So it is mainly distributed in the extracellular fluid. So correct answer is extracellular fluid. Gentamicin is polar, water soluble, cannot enter cells, and so it is distributed in the, so and the volume distribution is usually 10 to 50, 15 to 20 liters. Now we get to the third case, obese patient. Obese patient receives a lipophilic drug. Example is diazepam. Diazepam is a lipophilic drug. What happens to volume of distribution? So obese patient means more of lipids. Diazepam is lipid soluble. So what happens? It is distributed, the volume of distribution increases, more fat cells. So Vd is increased. So it accumulates in the fat. So the correct answer is Vd increases. So Vd increases, the plasma concentration, such drugs is low, and they are not dialysable, and they also got a long half-life. These are the important points to be taken. Next is a patient presents with the overdose of digoxin. Will hemodialysis be effective? We have already described that digoxin has got extensive tissue binding. So it is not in plasma, it goes in tissues. So dialysis is ineffective. Whereas lithium has got a low volume of distribution, it is dialysable. Next is a patient with renal failure and liver disease, has got hypoalbuminemia and is given warfarin. We have mentioned that the volume of distribution depends on the lipid solubility, protein binding, third is the tissue binding. So what will be the hypoalbuminemia, the effect on volume of distribution? The free drug fraction increases and there is a increased risk of toxicity. So in a patient with such patients are given drugs like warfarin, less protein is there to bind it, so the free drug fraction increases and there is a increased risk of toxicity. And what happens to the volume of distribution? A little mild increase in the volume of distribution, because hope you understood the mechanism. Because when there is less protein binding, this can enter the volume of distribution also increases. Now, in summary, warfarin has got a low volume of distribution, less than 10, you call it as a low distribution. This will be protein binding and is present in the plasma. Moderate 10 to 30 liters, so it will be in the extracellular fluid. More than 100 liters, digoxin is tissue binding. Diazepam is because of the lipophilic. Heparin, they are charged particles, large particles. So particle size is also important. So the volume of distribution is low. So heparin has got a low volume of distribution. So today I have discussed the factors affecting the volume of distribution, that is lipophilic, protein binding, tissue binding, size of the particle. I have explained the formula for calculation and a few case scenarios where volume of distribution is important. Stay tuned. Thank you.